Thank you so much, Jessica. Hi, everyone. Welcome. We're going to get our slides up. Okay, let's make sure. Pretty sure y'all can see those. I'm getting some nods. Um, I want to be able to see our team. We're absolutely so excited to be here and just so excited to partner with Mighty Little Giants and bring what Postpartum Support International does to your communities. So today's training and talk is the importance of postpartum support for NICU families addressing mental health and postpartum healing. Before we get into the content, I am first going to pass it over to Carol, our amazing co-chair, to give you a little bit more background on PSI California.
Great. Thank you so much, Megan. Can everybody hear me fine? Yeah. Wonderful. So as Ms. Jessica said, I'm Carol Mackay. I'm the co-chair of the California chapter of Postpartum Support International. I'm also the chair of the Underserved and Special Populations Committee for our organization, which includes our wonderful NICU families. I'm also a NICU baby myself. I was born 2 months premature, 3 pounds, 11 ounces, and spent 17 days in the NICU with my family. So I understand where we're coming from today, and I appreciate you all being here. So Postpartum Support International was launched in 1987 by Jane Honigman, and she had a perinatal mental health experience herself, and there was very little support out there, if any, so she decided to start a nonprofit organization, and it has grown exponentially since then. There are 51 state chapters now, and our chapter actually began in February of 2020, right before the pandemic hit. And we ourselves have grown very much. There were 6 board members when it started, and we're up to 18 now. And I just want you to know that we are very excited to be hosting with PSI the annual Postpartum Support International Conference in Los Angeles next summer, June 24th through 28th. It's the first time in like 14 years that it'll be here in California. So the first part, couple days, is the actual training that we can talk about a little bit later. And then the second half is the conference itself. So please save that date. Look for it in our newsletters and other information that will come out, and we hope to see you there. And I just want to say a special thank you to our wonderful volunteer presenters, Folake, Raag, and Megan, and also a special thank you to Jessica and her team at Mighty Little Giants. Off to you, Megan.
Thanks so much, Carol. Yeah, Carol and Jessica actually really helped make this partnership come through. So first, I'll just start with kind of anchoring us around the goals of Mighty Little Giants webinar series, which trickle down to the goals of our talk today. I loved Mighty Little Giants slogan or one of your mission statements, but we're really here to serve families with integrity, compassion, and encouragement. As a therapist, I am very relationally based, attachment based, and it just that really resonated with me that we really do all of this in partnership with the families that we support. So we're hoping what you take away today will help empower and educate and uplift NICU families, really help them engage with you in an impactful, meaningful way. We have a ton of great PSI resources that we hope will then be at your fingertips to give to families, the kids that come in, moms that come in, and really strengthen this community overall. Okay, so I wish I could see everyone. I also can't see the chat, so I'm going to ask Folake and Raag, our amazing team, if there'll be times where we want to get the audience involved. So maybe you two can be our chat readers if we need to like call out some of what's coming in the chat. But we thought about first just taking a step back and setting the stage. I know there's a lot of community organizations on the call, a ton of doulas, which I am hoping I'm an aspiring doula one day, and then a lot of current and maybe former NICU families. So some of this won't be new to you, but really the angle we're coming from here is recognizing this is not an anomaly experience. It's actually quite common. 10% of US infants are admitted to the NICU each year. And that has been, incrementally rising over the years. And we could go into the reasons for that. Due to COVID, a lot of specialty care offices closing, health issues going up, that this intersection of more new babies needing that higher level of care. Throughout today's talk, we also are really anchoring on what is the unique experience of each family coming into the NICU. Every experience, whether you're in for 1 week or in for 390 plus days, has its own challenges, strengths to it. And then a nod to Kimberly Crenshaw, intersectionality around their identity as a family. And so we like to think of, when you meet that patient or that family, what are the factors that are impacting how they're doing? Is there already a history of distrust in the medical system, justifiably? And how can I help meet them there? Whose family back at home? How did they get to the NICU that day? Was it the bus or a friend driving them? So really thinking through, how do those components of power and privilege impact someone's experience? And then the last piece I'll share, which throughout this presentation, is it's not so much that a mental health response is problematic, and we definitely want to destigmatize it. It actually really is the norm. This is a traumatic experience. And so any number of emotional, cognitive, or thinking responses, behaviors are going to be a test of your mental health. And really that kind of up and down is to be expected. I'll get into it in a little bit later. My firstborn, all the kids are over here on the wall. My firstborn was a NICU baby, and in hindsight, I'm like, yeah, all of that was very normal. And there was a lot of self-judgment of like, white knuckle it, get through this. Why aren't you coping effectively? And we'll talk a little bit about when those kind of negative thoughts come up, and how to support clients and patients. I'm going to shift it over to Raag to talk a little bit more about some mental health statistics and diagnoses we might see in a NICU population.
Now in this slide, we're going to see a bit of stats. So what happens usually among parents during the first month, 42% parents show clinical significant anxiety, 40% post-traumatic stress. When I say clinical, it does not just mean there is only worry, there is nervousness, but here the parents are really exhausted, and they are unable to sleep. They have intrusive thoughts. They might be having thoughts of the worst case scenario possible. So, seeing the numbers, when we see it's quite high, anxiety among mothers is 51%, fathers 26%. Depression rate among mothers is 31%, among fathers it is 12%, and the stress rate among mothers is 41%, with fathers 22%. So if you see the stats, it's quite high. So 40 to 50% parents screen positive for depression, anxiety, or trauma early in the hospitalization. Now, the anxiety prevalence in the NICU parents, as we see, it decreases to 26.3% and PTSD to 24.5% from 1 month to 1 year after birth. But seeing the baseline, for 14 to 20% mothers experience severe depression, that can be postpartum depression or anxiety during pregnancy and postpartum. 10% fathers experience depression before or after the birth of the child. So this is the baseline what usually parents go through. But if we add, you know, when a baby is born and it goes in the NICU, it needs intensive care, the rates of depression and anxiety doubles. As you see, that 1 in 2 mothers experience anxiety, and nearly 1 in 3 experience depression. Among fathers, 1 in 4 experience anxiety, and 1 in 6 experience depression during the NICU hospitalization. Now, why is it important? We need to normalize the response the parents are having during such a crisis. It need to normalize so that none of them feel isolated. The need of a support system is very important during this time. Now, how can screenings can save lives? So more the screening means more identification of caregivers who may need help, which could prevent worsening of mental health symptoms, including suicidality. Now we see there is a high rate of suicide among mothers during the pregnancy and postpartum, which actually shows that this is such a vulnerable period. And through screening, we will identify the symptoms, but also intervene, early on to help them. There are few screeners. So there are few screeners. As NICU professionals, we can do EPDS, which stands for Edinburgh Postnatal Depression Scale. PHQ is Patient Health Questionnaire. GAD is General Anxiety Disorder 7 screening, and PCL 5 is for the PTSD. These screenings will help us to identify the caregivers who need support before the mental health gets worsened.
Raag, is this one you as well? Oh, okay. I can hop in here. And I just discovered how to open the chat while talking. Try to multitask. But yeah, Raag, do you want to hop back in and do a quick overview of
Yes.
kind of
Yeah. So there are various perinatal mental health disorders which a birthing person goes through during pregnancy and postpartum. It can be postpartum depression, postpartum anxiety and panic disorder, obsessive compulsive disorder, bipolar disorder, postpartum PTSD, and post-traumatic growth, as well as postpartum psychosis.
Thanks, Raag. Just finding my mute button. So one area we wanted to drill into a little bit further is post-traumatic stress and growth. And I think when you hear PTSD, it can cause a little anxiety of like, oh, is this a full-blown diagnosis or what is that exactly? And this is an area I have a background in, and trauma treatments are incredibly effective. And I just always am looking to raise awareness around this. But I think a big misunderstanding that is out there is that all humans will respond to trauma in some way. There is such a wide range of how we respond, and that initial response is actually really adaptive. So for those on the call who work with families when the family's out of the NICU, or those doulas, nurses on the call, really being able to raise awareness about like, what is it I'm seeing that this person's telling me about, can help reduce stigma, can help reduce shame, and even help facilitate movement, maybe to see a therapist if these symptoms persist. So the PTSD diagnosis actually can't be given before 4 weeks. So there's at least a month of time where if you look on the left of this grid, these symptoms are to a degree adaptive. So it would make sense that when your baby is in the NICU that you'd be having dreams or nightmares or thoughts about it. It's our brain like making sense about this event that happened that was not a part of the plan. Trauma's labeled trauma because it's doesn't fit into our world beliefs or our system, right? Like I did not expect this to happen. Like how this isn't at all what I had quote planned. So that makes sense that as new parents, you might be having those thoughts early on. It's also really natural to want to avoid that setting. I remember and this can look different for every client, but I remember when my son was in the NICU, we have to be there. You can't exactly avoid being there, but I would avoid talking to certain people. And Folake will get into this later, and Raag will as well, of who are your support circles. But there were certain people I wasn't going to give them updates. It wasn't going to be a healthy, it would bring up harder parts of this journey for me. It's really natural to have a wide range of obviously ups and downs and mood. Oh, let me go back. trying to highlight my screen, or thoughts about ourself or the world, like what did I do, or this isn't fair, or all of this is quite natural. As well as that hypervigilance or hyper arousal. That's evolutionarily adaptive. That, like, my baby's in danger, I'm going to be on high alert to make sure, if I can, to protect him or her. The other piece I really want to elevate that I don't think gets talked about enough is post-traumatic growth. There's a lot of research around this, and I wish we got to hear more about those strengths, but so much good can come out of one of the most painful life experiences we have. It's actually brings up some emotion. I know this will be we did say that at the start, that this might be like a bit of a triggering talk throughout as we go, but I sometimes look back to moments there and was just surreal that this is something so scary, and yet I felt more deeply connected to my own spiritual beliefs. I was just so amazed with the strength around me, amazed with the people that do this work. And it really kind of shifts your worldview of um, how much you can appreciate that team at the NICU, and have compassion, seeing the other families in the NICU, and just knowing, like, we are in this together to a degree, even if we don't talk much. So anyway, wanted to highlight that for everyone, to just validate that for patients and clients, if they're not talking about what they're experiencing. I'm going to pass it to Folake to go into other symptoms you might see and what that might look like.
Thank you, Megan. I feel so touched just hearing your emotional response to just a really difficult topic. And thank you for just sharing that in that vulnerability. I think I think even just us as providers, just modeling that vulnerability is a way in which we show up for the people that we work with as well too. So I'm going to jump into symptoms. I love talking about symptoms as it relates to perinatal mood and anxiety disorders. I identify as a Nigerian immigrant. I'm Christian. I'm a mom of 2 toddlers. My firstborn was born premature. He was my rainbow baby. And also I'm a therapist. So I see myself, and I have gone through the things that I've gone through, and just look at how these symptoms just read and think about my own journey and my own struggles, not really being able to recognize that I was experiencing, some level of perinatal mood and anxiety disorders, because I'm looking at the clinical terminology, right? So what I hope that you all can take away from the symptoms is what it might look like, aside from just the medical terminology or the clinical descriptions. And so consider what you've noticed in yourself, what you notice in the families that you work with. One example I like to have you sit with is a mom who comes in, maybe coming for a visit with her baby, and she looks so put together. And from a parent, it might look like, she has it all together. She's managing okay. But I want you to consider what anxiety might look like, that desire to really control your environment, control the things that are happening around you. And maybe that her parents, and her ability to do her makeup, put on some nice clothes, is the only thing that she feels like she has control over, in such an overwhelming, stressful environment where things completely feel out of her control. So that's someone that you might want to make sure that you're also screening as well too. So just not relying on what a client might look like or a parent might look like, just based off of a parent's, considering making sure that everyone is being screened. And when we're talking about, BIPOC, Black, Indigenous people of color, what these symptoms might look like for them, it might look like a parent saying, just things feel just so heavy. Depression might look like things just feel so heavy. I just don't feel like myself, right? There's that guilt, that guilt around cultural or faith expectations. I should have prayed harder. This happened because of something that I did. So those are the type of statements that that sound like guilt, right? And that hypervigilance could look like, I just can't relax. It's hard to sleep when I go out at night. Go back home, at night after a visit to the NICU. Constantly looking at the monitors, afraid like something might happen if I walk away or if I leave. I'm looking at the chat as well right now. Yeah, just that blame, like, what did I do? Did I do something wrong? Could I have done something different? Some of that grief as well too. That anxiety, not eating well, feeling like your focus has to constantly be on your child in the NICU and not even being able to sleep when, the nurses or providers are letting you know, like, your baby is sleeping right now, take a nap, go home and relax, and just not being able to sleep because of fear, like something might go wrong if you close your eyes, if you leave your baby for a moment. And also just want to note the cultural emphasis on strength and endurance and faith. And so there may be a delay in seeking help. There may be, that birthing person minimizing what they're experiencing due to the cultural expectations, due to the faith expectations. And so, Megan, you mentioned like there's just certain people that you might have not shared what was going on. For me, it's like, okay, certain people, I know that, you're going to tell me to pray, which is also important. And I also need this level of support as well, too. So that combination of both. And so those scary thoughts, those intrusive thoughts that show up and are discussed as bad spirits or evil, when there's that strong religious emphasis as well too, really wanting to look out for what these symptoms might sound like aside from just the clinical terminology. And then birthing people may hold back emotionally to protect themselves from their baby due to fear that their baby won't survive in the NICU. So there's that difficulty to bond as well too. Next slide, please. Thank you so much. And even in partners as well too, in families, there may be that struggle, that challenge where maybe that mom or that birthing person might look at their partner as being really disconnected, like, spending time playing video games, spending time hanging out with friends, doing other things, seeming so withdrawn. And so in men, irritability, their perinatal mood and anxiety disorder show up for men as well too. So that irritability that might be outward in maybe women, naturally, it might show up as withdrawal in men rather than open expressions. So wanting to keep that in mind as well too. Next slide. Thank you. So now getting into some risk factors, what are some of the things that, put someone more at risk of experiencing a perinatal mood and anxiety disorder? Well, one topic is having a child in the NICU puts you at a greater risk than your counterparts of experiencing a perinatal mood and anxiety disorder. And research also shows that Black, Indigenous people of color face higher risk of experiencing a perinatal mood and anxiety disorder due to just general, cultural, and specific factors. And so there's also access to healthcare, lower rates of screening. If you think about the strong Black woman syndrome, there's that perception that, I have to show up this way, I have to present myself this way. And then there's also historically been a minimization of the symptoms that Black women are experiencing as well too. And so just the lack of culturally relevant support systems and less access to doulas or peer support, BIPOC families may show up in these spaces and feel dismissed or stereotyped or discriminated against. And having a history of trauma, childhood, racial, or medical mistreatment as well. So it's important to note that the support and how the birthing person perceives the support are two totally different things. So on surface, it may look like, okay, well, this person has their partner, or this family has, they're intact, they have grandparents around, they have a doula around, they have nurses around the clock, they have all these providers, have therapists around the clock. But how does that birthing person or that family actually perceive their support, right? How do they view the support as actually supportive as well? So that's touching into the lack of culturally relevant support, lack of support from friends and family as well. And having twins or multiples as well too. And also having experienced, perinatal mood and anxiety disorder in the past, or even having, prior to giving birth having experienced anxiety or depression. Maybe this is the second time around that a child has been in the NICU. And maybe there are multiples in the NICU as well too, or maybe there's multiples at home. Maybe there's, other siblings in the house as well. Next slide. Thank you so much. So who is impacted? So there's a lot of focus on the baby in the NICU or the children in the NICU, and which is why we are presenting on support for, these families. And so it's important to attend to the whole family. Research shows that dads have increased chances of experiencing perinatal mood and anxiety disorder if the mom, the birthing person, is experiencing symptoms as well. It increases the likelihood, the percentage that the father will also experience it. And remembering that looks different, right? That withdrawn is it could be a perinatal mood and anxiety disorder. So it's important that when screening, if that birthing person is showing positive symptoms for perinatal mood and anxiety disorder, consider screening the partner as well, if the partner is present as well too. And so, why is this all, important? There's many people who are impacted by the lack of support that families receive when they have children in the NICU or a child in the NICU. So research shows that lack of social support significantly was associated with high maternal distress and depression than with mothers who had supportive networks as well too. So it just means that, in a nutshell, there's better outcomes for birthing people, there's better outcomes for families when there is support. The research showed that moms were able to learn new ways of taking care of their children, that their support networks were able to offer tangible resources in form of childcare and financial assistance, and the networks act as a buffer against maladaptive parenting in stressful situations. So when you think about the siblings who are affected, having a parent experiencing the perinatal mood and anxiety disorder has a correlation on how the other child in the home is being parented as well too, and how that parent is showing up as well too. So it's important to consider that treating the family as a whole as well too, and remembering, keeping in mind that when you're administering treatment, that the NICU experience impacts the whole family. All right, we're in the next slide. Thank you. Okay, and then also providers. Providers are impacted too. NICU nurses and physicians, social workers, lactation consultants, they're impacted as well too. They're exposed to daily trauma. There's a word that it's called, I can't remember it especially right now, but that constant exposure to trauma in situations and the environments that you work at as well too. And those individuals are also bringing that home as well too, to their family, and they're showing up with this trauma that is weighing on them as well too. So it causes distress, and it causes a lot of vicarious, thank you, vicarious trauma. I see it in the chat. Yep, that's the word I was looking for. Thanks so much. So the entire circle is impacted: parents, siblings, extended family, providers, anyone is also prone to experiencing this vicarious trauma as well too, serving the individuals in the NICU.
Thank you so much, Folake. Please chime in on the chat. Thank you, Ashley. That was the best. Trying to get audience participation. We're going to pivot to the more interactive component. We've talked a lot about what are the symptoms to look for. Raag went over some of the screeners, which I think are a huge help. I think research shows giving screeners, and even for our community partners on the call, when you're seeing families months after their discharge, it just is an opportunity to raise a little bit of awareness and be able to give out some resources of maybe if you want to talk to someone, it's a space to process what's going on. So right now we're shifting to our section around helpful interventions that you all can do. So I'm going to switch as those that are supporting NICU families. So I'm going to try to do this the best I can. If you can pull up this website on your phone or even in another window, you can go to menti.com and enter the code. Thank you, Jessica, for putting it in the chat, 7229-9230. And I'm going to try to escape and go over here and share with us one word or a couple words that really describe how it feels to show up and support NICU families. And I'll wait a minute for some responses. I'm seeing some heartwarming. It can be bittersweet, rewarding, absolutely exhausting, and scary at times. Critical, necessary, being present. And if you want to use the QR card, it's up there too if folks want to add words. Let me move my chat. What are the ones I see? Compassion, anxious, crucial and critical, heartbreaking, yeah, heartwarming. And even like, I'm not even sure how to describe it. There aren't words, right? Sometimes it feels that way. We wanted to take this opportunity to hear from you. There's a term in therapy like dialectical therapy is meaning like two opposing truths can exist at the same time. And that is just like at the core of the NICU experience. Like this, like my support for my patients is so incredibly critical and necessary. And yet how can I also feel scared at the same time and then overwhelmed with like love for being able to do that or show up for someone? Like you're holding all different emotions at the same time. And I think I mentioned it. Let's see, we got difficult, challenging, walking between worlds. Exactly. Someone else cued in on the dialectics. The reason we wanted to do this, in part to bring you all in, let me see if I can escape and go back to, is because we want to talk through about 5 coping strategies that we thought we would highlight that really are from a mental health perspective. Like our focus today isn't necessarily on how do we handle the logistics of the transition. And I said at the start, because I think so much of this is about relationships, like the NICU team and the team after are the extended family. And so there's a lot of opportunity to be that like secure attachment for families coming into the NICU. So we're going to talk about what to say to families, which many of you probably already know, but it's always good to have like some go-to phrases. We'll talk a little about what not to say, how to be mindful of the transition home in particular. Raag will go into a really awesome exercise that you can do with patients with support quadrants. And then Folake is going to talk about decision-making. This is a great intervention you can teach to your patients and families. And then we'll touch a little bit on burnout. And we are like on schedule, so we can really lean into this section. And I just wanted to highlight, these are some we're talking about, and obviously there's a baseline around supporting families to pay attention to prioritizing sleep, movement for their body, getting outside, nourishing food, being with supports and leaning into their spiritual and faith practices all really help this, like the mental health healing journey. Okay, so, and let me get my chat again. I actually think I'll have an idea for getting more of you involved. Show the chat. Where is my chat? Okay, I might have to use Folake and Raag, but sometimes I think most of you likely know what to say, but it's really a helpful reminder. I think sometimes we can feel overwhelmed, like I want to say the exact right thing, or I want to take away this pain for them. But just remembering that often the most powerful thing we can do is listen and just witness and be present, even if it's in a nonverbal way, or offering simple words. So that might sound like, this is so hard. You're not alone in feeling this way. Or reminding families like you are doing an amazing job, even if you're not feeling that right now. Like sometimes it's being our family's cheerleaders. It's okay to also let them know, nudging, planting the seed that it's okay to need support. I think this has been touched on a little bit. It's very common in like the male gender too, of like, we don't ask for help, right? We problem solve and buckle down. And in my head, I'm picturing my husband. Not all, I don't want to generalize about men, but it's like this idea of like talking about your feelings is really foreign and scary and even stigmatized. Or just even asking, can I sit with you for a few minutes and be present. If they've gotten some struggling news or an update that they were expecting something different, or even reminding families that they can leave. Do you want to take a break? They can step outside, and I can stay with the baby. I thought I'd ask folks put in the chat. I can cover some of them, but I'm wondering if, maybe with a little bit of bringing a little humor in today, like what are some things not to say? One great one we all know is, well, at least this didn't happen. Well, at least your other baby's at home, right? There are just certain things we know minimize struggles, kind of narrow the conversation. And I'm just curious, as we're talking about this, I'd love to hear don't worry, dismissing the pain, any that are a good reminder, like to steer away from. Yeah, at least. And many of these, I also want to emphasize, still apply months out, even, at least you can go home and get sleep. Oh yeah, oh God, that one really bugged me. Like, I don't want to be at home. Like, where's my, and sometimes there are obviously beds at the NICU. Everything happens for a reason is a really complicated one if we think about where that originates from. And it really works on someone who is trying to come and says, "Oh, don't cry." Oh yeah, yeah. And it's so across so many of our cultures to minimize emotion, absolutely to push those down. That's a great, who put that in? Gabriella. I love how you can also take these that you're putting in and take what's on the slide and think, if I see a mom crying, how can I just physically show her like that's okay, rather than like ushering her away or just like not saying anything, letting it be, putting a hand on her back or something. Yeah, these are really good reminders. Oh yeah, you're young. You're young, you're old, you're mature, you're all the things. Yeah, yeah. And knowing, we'll get into this a little bit later, but really knowing your own boundaries of like, what is going to be hard for me to hear so I can be prepared when someone inevitably says something. Okay, thank you all for jumping in with some of those. Absolutely, silence really is incredibly powerful and an art to know how to do it thoughtfully. Good call out, Gabriella. Another one I'll cover and then we'll shift is we would be remiss if we didn't talk about the transition home or out of the NICU. And sometimes there's multiple of those. And as we were preparing for this talk today, actually a shout out to Angelica. I think she's on the call. She's another one of our PSI therapists and volunteers who helped with a number of these slides. But she was talking about, you hear patients say so often, we physically left the NICU, but it felt like we never left sometimes because you're coming back for follow-up appointments. You're seeing your baby's health chart, and the focus is so on the baby or babies. And it's really helpful as whether it's later of a community organization that supports families or NICU or doula teams to remember that the whole family is going through this. And that the well-being of mom, grandma, family, dad all matters. So it's kind of similar to preparing a birth plan. It's like you can have a plan of what you ideally want to happen or the supports you need or what you think might come up. And some of that may go out the window, but even talking it out with families so they can start to think through what they can anticipate, because it may not be on their radar. Discharge can happen so quickly, like all of a sudden, okay, and then it can be like a stop start, right? Like you're going home today, and then like the paperwork's not done till 6 p.m. So just normalizing that for them, and that there can be a lot of grief in that process. It's a huge loss. Sure, relief and excitement of leaving, but this loss of this 24/7 team. And so just naming that, letting them know like that might feel a little unnerving when you get home, but you've got this. Or asking like, how can I support you in that? I'm glad you're able to come. I'm catching up on the chats. Maybe bringing their awareness. Like, hey, do you want to talk through what it'll be like to come back for one of those pediatric visits? Or seeing that milestones chart, like what would help you to feel to support you emotionally as you're navigating these like 1 month post discharge or 6 months out. Another big one, and I know we have a lot of people on, I saw in the beginning, like Monica's at a preschool program in San Bernardino, or Victoria, I think you put in like you're with a family resources team, like absolutely the family unit will likely have changed. And Lakeithia, you called that out too, like the sibling dynamics. I think just naming that of like, how did things used to run in the house, and like, what do you think might be different? Or don't be just, don't be surprised if things are a little bit up in the air and chaotic for a while as you figure out your new unit, and work together. And just also normalizing that ongoing worries may show up, and building in opportunities to celebrate wins, resilience, then milestones, a big one. And each of this is personal to our, like what I say right now, someone else will be like, that didn't work for me. But I will say two things still stand out to me is I always wanted to make sure I got that NICU graduates email and I could go back and the hospital would do like a picnic party for graduates. And it just meant so much to me to see like we're still a part of that family. Like this happened because my oldest is 8 now, but there are people that go back to these graduations when their kiddos are heading off to high school. It can be really hard to go back to that first one, but if that's something that might feel reparative or help you process this journey, that's one that helped me. Another, I know it's such a giving community. I know I left feeling so indebted to that team. And obviously, it's maybe not professionally the boundaries. No one, they're not going to let me call them afterwards. But I went back and brought some food or whatnot. I think that happens quite a bit where you're like, I want to go back and thank this team that helped us. So these are just ways to recognize progress and like leaving that space. Let me see if there was any. Yes, yep, the 4th trimester for a NICU family. Good language, Lakeithia. Thank you for adding that. Yeah, flowers. Yeah, just keeping again like about that relationship with the space that was your family. Okay, I will transition it over to Rag for our next kind of area to focus on, which is these exercise around support quadrants.
So this is going to be an interactive activity. So while we go on each support in the chat, you can write what you are feeling, or when I ask for I talk about a prompt and what comes in your mind, you can just take a moment and go, and we can do this together. Yeah. So before we start, now I'll start with a very simple example right now. So think about like the chair you are sitting right now. It might be having 4 legs right now. What if one leg of the chair breaks down? It wobbles and you feel unsafe that I'm going to fall. So, in the same way, the support for the NICU parent works like a chair. It needs 4 strong legs of support to feel steady during this hard time. Now, we will be going uh, through each of the support, but we'll go with an example. And while I talk about this example, uh, I would like all of you to, in the chat, write what you feel or what would you do in that situation. Yeah. So let's take an example. Maria delivered her baby, Emma. She was born early and she had to stay in the NICU for 4 months. Now, this example will show you the importance of the support system, how it looks like. So first, we go to the emotional support. Megan, we can go to the quadrant directly. So, yeah. So first is the emotional support. Is that someone who understands you without feeling judged? Now we'll take a scenario. How does the emotional support works? Now, Emma got sick one day. Maria was seeing through the glass windows what is happening, and she felt helpless. In such a situation, what would you do? It would be great in the chat if you could, write the way How would you share the feeling what Maria is going right now, or how would you try to express her what's happening? Give mom a hug. Anything else? Hold mom hand, be present, yes. So your emotional support system, for example, it can be your partner, it can be your best friend, it can be a sibling being present, available at any time, true, or it can be the peer NICU parents. Do you want, yeah, Megan, good. Do you want to talk or check? How can I help? It really matters. So giving that safe space where you give the space to the NICU parent to express what they are going through during this hard time without being judged and not dismissing what they're going through. For example, like when we take this example, uh, what if one NICU mom comes, for example, Sarah, she says that I saw what was happening. I know it might be so tough for you. So, in this way, we are saying that what the mom is feeling is quite normal reaction, because seeing the baby in the NICU, it raises lot of emotions and you feel helpless. Like, what can I do in this medical system right now? So, just being there, validating what they are feeling plays a very important role. It is very important that to make you feel normal, that feeling scared during this time, feeling the having the fear what is going to happen next, the uncertainty, I these are all normal responses. Moving next is the practical support. Rub her hand and letting her know that you are there. Yeah, acknowledging the feelings. I'm here with you. All are valid. Absolutely. Now, moving to the next is the practical support. Now, let us continue with this example. Now, it's been 5 weeks. Maria and James are really very, very exhausted. So they have spent 14 hours a day in the hospital. Now, what happens? The neighbors or the family sees that now the family is, the NICU parents are quite exhausted. And how can we pitch in to help? So, back to the audience, how would you support the NICU parents during this time? Practical support. That means that it can be the everyday chores, so that the parents can take a break, have that save that energy when they're in the hospital or taking care of the baby. So what are the different kind of practical support or everyday support you could give to the NICU parents? Cook, order meals, offer transportation, prepare meals, even taking mom's bag when she gets small things. Absolutely. Food train with friends. It would be great if the facilities can have accessible and easy parking. Bring good food that can be frozen or cooked later. Collaborate with family and friends to organize a meal train. Housekeeping while she's resting, giving her a break from everything. Absolutely. Grocery shopping. Bringing in routines from home to the NICU, like ordering pizza on a Friday to the nights when they're used to at home. Vouchers, on-site fruit, vegetables, platters. Baby showers are a great way of supporting to sign up for tasks. Cook meals, deliver, to eat food. Absolutely. Making sure mom and dad are taking care of themselves, facilitate self-care activities, yes. Vouchers for frequent transportation trips to the hospital. Absolutely. So yes, you guys covered almost everything which is possible. So yeah, these are the things. In-home massage, yes. Help with meal plan, lighthouse, keeping strong breast milk, helping with storing the breast milk, massage, make sure nourished and hydrated. Absolutely. Cook meals, organize meal train on rotating schedule with friends. Yes, so we covered almost all the possible ways we can help the NICU parents during, this time. And yes, maybe partnership with wellness organization to provide workshops, events, send encouraging notes or text to show that you're not alone. Absolutely. So here's the practical support that we can assist the NICU parents. And I wanted to add one more thing to it, the sibling care. So when the NICU parents at the hospital, they are worried what my other kid is doing at home. How is the kid going to manage? Who's going to help? So pitching in during that time that you know I can take care of the child right now. Take him, maybe somewhere outside, like to a park, setting up a play date for the older kiddos. Exactly. Get information that will facilitate their need. Yes. Help with school drop off, pickups, helping them with the meals and doing, um, what makes the older kiddos, feel comfortable during that time so that, the NICU parents don't feel guilty that, I am not able to see the elder one right now because I had to be in the hospital. NICUs should also have family rooms in case parents have to bring the other child too. Yes. Anything else you guys want to add? Absolutely. The idea is really access to social workers, yes, for more support. Yeah. Teach parents infant massages, yes. Babysit at home so parents can rest or eat properly. Child life specialist to support siblings. Absolutely. Now we move on to the third kind of support, that is a good bottle of informational support. Now, the third one is informational support. When we say informational support, it means the people who provide, guidance, advice, or the NICU knowledge. For example, like the example which we are taking right now. So the doctor comes and tells the NICU mom, okay, this is a procedure, we are going to carry it right now. And the NICU parents are confused because they are all medical terms. They can't understand. Usually, we would, Google it. What does it mean? And once we Google it, it creates more anxiety. What is going to happen? What are the risk factors involved during the procedure? So during that time, NICU professionals, it can be, a NICU nurse, to see the signs if the parents are feeling stressed or anxious, go to them, talk to them, and just check in with them that are you nervous or do you have any questions about the procedure? So a nurse can help them to simplify these medical terms into the language which is easy for the parents to understand what is going to happen, so that they feel certain, that yes, this is going to happen, and what will the process be about. Explaining them in layman language plays a very important role that time, because if we start googling the symptoms and the procedure, it just increases the level of anxiety. The nurses can also help to break the ice between the parents and the doctors. Like they can ask any question. It might, parents at times feel silly. Is this, silly question to ask? Will they think that, oh, I'm not smart enough to understand this? In that case, the nurse can play an important role to break the ice and tell the parents, ask any question you want with the doctor so that you feel supported and you know what is happening during the process, medically or during the procedures. So now I would like to ask, like, can you just think of who you can turn, for the accurate, helpful information during the baby care? Something I took away from the last session is the power of encouraging parents to request a primary nurse for the child care. Interpretation services, yes. Take a break from everything by taking a walk, pamper yourself, listen to a soft music, etc. Yes. Moving on to the fourth quadrant, that is the self care and coping resources. Now, this means that, activities or resources that can help you to manage your stress and maintain your mental well being. In this, the social workers can play a very important role by providing them the resources of mental health professionals, by giving them a list of therapists, a list of peer support groups for the NICU parents, so that they feel supported and not isolated during that time. And it is also yoga, sound bath therapy, yes. Ashley, it is also important that the nurses have the capacity and time to speak to the parents' questions. Sometimes the nurse parent patient passion in the ICU is very high, not allowing enough time to speak. Absolutely, it's very important that they take out time and you know clarify all the doubts or the questions the parents are holding. Yes. So, the self care can look like, going to therapy, joining a peer support group, going for meditation, going for a small walk, doing, any activity, maybe just sitting by yourself, having a cup of tea or coffee, whatever makes you feel comfortable. So, any small activity that you can take to recharge yourself plays a very important role because during this time being in the NICU, it's a very tough time to be honest. It brings up a lot of emotions which are very strong, such as helplessness, guilt, shame, because at times you're like, oh, I have to show up to be very strong. But during that time, using the brain format, benefits, risk, alternatives, information, what if I do nothing? What are the consequences? Yes. So by doing, we have NICU essential self-care kits that they can request on site for free. That includes devotionals and self-care activity. That is lovely, Jessica. That will be very helpful for the NICU parents. Normalizing the feeling of fear, guilt, or helplessness. Absolutely, these are all normal responses to in a situation to be in a NICU. So yes, not to make the NICU parents feel guilty, be thankful that you are alive, the baby is alive. It is a stressful moment, and these reactions are literally normal reactions. And when you feel a NICU parents need support, provide the hospitals can provide them with a list of mental health practitioners, NICU peer support groups, or other kind of resources that are available. So yes, so these are the four quadrants. The importance of this is that you come to know what kind of support I have and what are the gaps I can work on and how can I work upon these gaps or where can I get this support from. Mindfulness, breathing, exercising, talking therapy is great. Yes, and no judgment if they can't in their everyday life. Life is still outside of the NICU. Giving them grace will also give them a peace of mind that they can show up. Absolutely. Yes.
Thank you so much, Raag.
Yeah.
I was going to say, as I transition us over to Folake, you literally can pull out a piece of paper, draw 4 quadrants, and sit down with that family and have them start to fill it out, both in the NICU and after. And like in therapy, we do a lot of like homework and exercises sometimes, because really activating someone to start doing that goes so much further than kind of just talking about it. So we encourage you to do this with the families you work with. Okay, over to you.
Thank you. I enjoyed reading, I was following the chat, just like all the suggestions of different ways to show up, and just imagine how showing up for that family, that birthing person in the NICU can impact how they make decisions, right? With just what their well-being would look like, and how that has a direct impact on how they make decisions. So just when it comes to decision making, lots of decisions need to be made when you have a child in the NICU. Imagine being a parent whose baby is hooked up to monitors, and some of you don't have to imagine it, that this has been your lived experience. And you see it, and just surrounded by machines, and doctors are asking you to make different decisions that feel impossible. Um, that's the reality for NICU parents every day. Add to that systematic racism and bias in the NICU, and add to that a birthing person who is experiencing a perinatal mood and anxiety disorder that's impacting their ability to make decisions. So it's important to just recognize what's in the room with you, what's in the room with the families that you're working with when asking them to make different decisions, because a lot is thrown at these families so quickly, and it feels, the perception is that I need to make this decision so quickly. And so just want to encourage you, if there's our parents on this call, or you're working with parents, to slow down, right? First, acknowledging power differentials. We providers serving these individuals are in a position of power, especially working in the hospital, right? We have to document and notate everything. And so when there's racism or bias in historically, systematically, then there's this concern or this worry that, I have to do what is being asked of me, or the worst case scenario, my child is going to be taken away, right? Or if there's anxiety showing up, like I have to do this, or this bad thing is going to happen to my child. And so the cultural components, the things that are important to these families, there's no room for that. There isn't any space that is created for those other parts to exist, and to help these parents make these important critical decisions. So just really reflecting on your own biases and power dynamics when supporting families, and recognizing that it's okay to ask questions, even if your questions are not perfect. I think I saw in the chat someone mentioning the ratio of nurses to patients as well too, or NICU babies. Encouraging these families to write down your questions, like, hey, we may not have as much time as I would like for us to spend talking through some of these decisions that you need to make. How about you write some of the questions that you have down, right? Or, this provider is scheduled to meet with you at this time, encouraging yourself, encouraging the people that you're working with to write some of these questions as well down too. I'm just following up on the chat. And so asking for explanation in simple language. I've worked in a hospital setting before, and there's still some terminology that is just like over my head. So I've had meant to ask many times to ask to clarify, like, can you make this in simpler terms? So imagine like a family that's faced with all these decisions that need to be made, and all the medical terminology, all the medical jargon that's being thrown out at them, and the difficulty in just really, coming to terms with what decisions they need to make. I think about my hospital stay when I gave birth to my firstborn son. He was born at 35 weeks. And I had my birthing plan and everything. And so the doctor came in, the pediatrician came in and said, all right, my son was 5 pounds, 7 ounces. He brought in, you know, those little small hospital formula, the little tiny ones. So he brought a bunch of them in, laid them down at my bedside and said, all right, you need to start him on this. We need to get his weight up. And I just said, okay. Because in my head, like I need to do whatever I need to do that is going to keep my child safe, keep him alive, keep him healthy. And everything that I had planned in place with breastfeeding had went out the window in that moment. And this was an older white male doctor who came in. And it was the lactation consultant who saved my breastfeeding hopes, my breastfeeding dreams. She came in and she saw all the vials of formula. And she's like, what is this? Who brought this here? And I'm like, well, the doctor, he said that I need to do this. Right. I didn't feel like I was in a position of power. I didn't feel like I had a voice. My concern, my priority was that my baby stayed healthy. Right. And that's the concern of all NICU families. And so this is what I was asked to do. And so that's what I feel like I need to do. And she's like, no, you don't need to do that. Your milk is coming in. Your milk is coming in and you are making enough milk to feed your baby. And that was the only time that my son had ever had formula, when he was born early, just that one little container thing, because I had someone in the room present with me to advocate for me. She wasn't in the room at the time, but she came in afterwards and she remembered my birthing plan, and she took the time to really look at what was important to me, and she gave me space to share what was important to me. And so just giving that space, it really only requires that one person to give that birthing person, those families, that space and opportunity to share what's important for them. And so bringing an advocate, my mom, she's a nurse. So she was my like phone a friend, phone a parent. I had her on the phone, even though she was there when my son was born. There was some times where she stepped away. So she was my like phone a provider. I called her and I'm like, I would tell the providers, my mama's on speakerphone. So everything that you're sharing with me, she is listening in, because I can't really understand medically what you're telling me. And so she is not at the heightened state of anxiety that I'm at. So she's able to put on her nurse hat and hear this information. And then also she knows me, she knows my values, what's important to me. And then we're able to she is able to encourage me to ask questions. So have someone who's going to encourage you to ask questions, who's going to even ask the questions for you. Have a note taker present with you. If you're taking notes on your own, read back to the providers. This is what I heard you say. I just want to make sure that I got this down very clearly. And so really just, considering, what do you want to know? What do you want clarified? What do you need to feel confident to make decisions, right? Considering all that in your decision making, even asking the families that you're working with, what do you know? What information do you know based off of what's happening right now? What do you need clarified? And what do you need to feel confident in making these decisions as well, too? And also having families participate in medical rounds as well, too, as appropriate in hospital meetings, as appropriate, having them involved in these team decision-making meetings as well is vital. Next slide. And so just balancing expectations as well, too. So the vision for your baby's birth may look different than what is medically recommended, right? And so what you hope for is going to look different now than what is being recommended. And so asking about the pros and cons of each option as it aligns with your values. So helping families weigh medical recommendation with cultural, spiritual, and personal values as well, too. Does this decision support my baby's health, my family's well-being, and our long-term values? And so that's when we talk about preventing decision-making burnout and being able to focus on values-based decision-making as well, too. And so takeaway, remembering that your voice matters and that you have the right to clarity, respect, and support in every NICU decision, focusing on what matters most and knowing it's okay to revisit your decision. So if you made a decision yesterday, you slept on it, you talked to a provider, you talk to your support person, you talk to your doula, you talk to your pastor, you talk to your therapist, you talk to someone, and you have a second thought about this, it's okay to revisit your decision.
Thank you so much, Folake. Yeah, that it's so key, right? When everything feels so critical.
Yeah.
All right, we want to make sure we leave enough time for Q&A. So you will get you resources after. Burnout was another area we wanted to highlight. I'm going to just highlight one item here that sometimes suicide thoughts can come up when we're feeling incredibly overwhelmed, whether we're the family or the provider. And I just wanted to name that one that it's okay to talk about that. And it also can sound like many different things, right? It can sound, there's something called passive thoughts of like, I just don't want to be here anymore. I just don't want to wake up. And it's okay to validate that if a family member or yourself as a provider is feeling overwhelmed and those thoughts are coming up. But it can naming that and describing it can be really helpful to understand like, okay, where does my mind or someone's mind go when they're feeling extremely overwhelmed? We have a couple resources here on coping with burnout for both families and providers. But what I want to make sure we have a little bit of time for, and then we'll shift to some Q&A is, actually, I think I might be sending this right back to Folake or Carol. I'm now not remembering, but some resources for parents that PSI has, and then resources for providers as well.
So I'll go ahead with the PSI resources for parents.
Great. Okay, Raag, go for it, Raag. Thank you.
It's our PSI website where you can find support and find local help, education, and local resources at the website. There is a PSI helpline number, which is in both English and Spanish. We have a provider directory where you can quickly and easily identify professionals who are trained in perinatal mental health. You can search by insurance, state, specialty, and more what you're looking for. We have free online support groups for NICU postpartum parents where you can register. We have peer mentor program where a parent is in a need of support. They are paired with a trained volunteer who is fully recovered survivor from perinatal mental health disorders. Next, Megan. We also have in the PSI app, you can see that we have a chat with an expert where you connect with other parents or talk with the PSI mental health expert about resources, system, and the treatment options. For the dads, it's first Mondays. For the moms, every Wednesday. PSI on Smart Patient Forum for women affected by perinatal mental health disorders to share, interact, and learn from the peers in a safe and a supportive environment. Perinatal mental health discussion tool for parents to identify the systems and to discuss with their providers. We are on social media, that's on Facebook, Instagram, Twitter, and LinkedIn. And there are more resources. March of Dimes, where you can get education and tools during and after NICU stay. Hand to Hold, where you can find peer support, podcasts, and NICU parent mentors. Our Mighty Little Giants for family advocacy, education, and community services. NICU Mama for stories, resources, and supportive community. Graham's Foundation for NICU care packages and parent support programs.
Thanks, Raag. Hello, everyone. So PSI has a variety of resources for providers as well. So if you're working with a family with a doctor, OBGYN, and they have concerns about providing prescription medication to someone who's pregnant or postpartum, there's a perinatal psychiatric consult line that they can connect with. As Raag said, there's the provider directory. PSI is one of the largest accredited organizations that provides trainings for medical and mental health providers around perinatal mental health. And they have their annual conference that we talked about, which will be in LA next summer. There's frontline provider training, so they can come in and do training specifically to your organizations. We at PSI California also can do that as well. There's the perinatal mental health certification. So if you take the training, you can become certified as well, and that is an exam process. And there's mentorship through that, through PSI and through the Perinatal Mental Health Alliance for People of Color. So if you become a member of PSI, you would automatically become a member of the Alliance if you're a BIPOC provider, and they have very specific services around support and mentorship. Membership also helps the chapters, so parts of your membership fees come back to the state chapters, and for us in California, a lot of that revenue goes back to scholarship for providers in California. And then you can also become a member of our state chapter, so we encourage you to do so.